Hello, everyone, and welcome to the Toronto General and Western Hospital Foundation's virtual Q&A. I'm Christian Cote, host of the UHM podcast Behind the Breakthrough, and we're glad you could join us today. Grateful to you, our family of supporters who've been so generous throughout the COVID-19 pandemic. So a big thank you on behalf of the foundation and all of UHN. Today, as the province continues to reopen, we have the latest on protecting yourself from the coronavirus. To help us navigate all that's going on, as we're pleased once again to be joined by the UHN infection control physician, Dr. Alon Vaisman. Welcome back to the live stream, Dr. Vaisman.
Thank you for having me.
Let's start with the big picture. We've seen a steady drop of new coronavirus cases in Ontario since late April. And then in July, there's been a leveling off, some spiking in terms of cases. Does that concern you at all?
Yeah, it's an interesting question. What happened in July? It looked like people were doing very well with complying to the recommendations throughout May, June, and then in early July. Then there's a spike. It's likely that some lapses in following the recommendations occurred in mid-July. Perhaps it was young people, perhaps it was other people, but that might have explained this small bump. It's important to realize that from day to day, the numbers aren't as important as looking at week to week or 7-day averages or 14-day averages, because we expect there to be fluctuations in the numbers from day to day. It's natural to happen. There could be delays in testing or lags in reporting of tests. So more importantly, it was the overall trend. But certainly there was a slight bump, but fortunately it looks like we overcame that.
Yeah, certainly from today's number, although it does seem to fluctuate. I understand in these numbers from July, in terms of the spikes, you mentioned this, it's quite a number of those cases are being attributed to people under 40. What's your sense of why that is?
Yeah, there's two obvious explanations for why that might be. The first is that younger people are actually getting more infected than before. And the second explanation is that younger people are getting tested more often. And I think it's probably a combination of both. And the latter explanation is actually reassuring. It's a good sign that young people are actually going out and getting tested, whether they have symptoms or not, to find out whether they have the disease. So that, in combination with the possibility that there could have been some lapses among young people in following the recommendations, could have explained why we saw an increase among that group. Interestingly, that pattern isn't new. We saw that in southern United States, in Texas and Florida, where there was a shift from elderly people to young people. So perhaps that's part of the pandemic, part of the flow of a pandemic, that you start to see a shift to younger people as they get more involved in testing.
What about these spikes, though, over the past few weeks? What do they say to you about the pace of reopening in Ontario? Because, like, Toronto now has just been given the green light to move to stage 3. Are you concerned at all that we're rushing things, or are the public health guidelines providing enough safety as we reopen?
If you look at that question in two ways, one outside of Toronto, Ottawa, Hamilton, and then two looking inside those cities. Outside, I think it's clear that the decisions were made at in the right speed. So those areas are moved up in terms of phase 1, 2, 3, and we haven't seen outbreaks in those areas. We've seen that there's been quite good control. As for what's going on in the other cities, when the phase moved from 1 to 2, we did see some bumps, as you mentioned, but things have been stabilizing. So it does suggest things are moving at a reasonable pace. So it's all about whether you're communicating properly to the population. So if you are moving from 2 to 3, you could do it next week. You could do it in 3 weeks, 4 weeks from now. You may have the same poor or good outcome, but it all depends on the communication. If you're communicating to people, letting them know what you should be doing, what you should not be doing, then you'll have a smooth transition and you'll have a good response.
Absolutely, and I get that it's really tough to, balance public safety with the need to, get the economy going again, and that's not an easy balance. And I read today where Hong Kong, which has been seen as a success story for controlling community spread of the virus, it's on the verge of an outbreak, and it's now shutting down its restaurants and bars and gyms and beauty parlors. That prompted an epidemiologist at the U of T that I'm sure you know, David Fisman, to say, quote, "It would be cool to learn from others rather than feel compelled to make these mistakes ourselves," unquote. What do you think of that?
Yeah, obviously, whenever there's incidences across the world, especially when people have moved ahead beyond what we've done here in Ontario, Canada, it is a good idea to learn from what they've experienced. The question is, what should we learn from them? I think Hong Kong and many people would agree that had an excellent response to the pandemic in the beginning, starting in January, February, March. And now that they're 6, 7 months out, they're seeing some of the lasting effects. that even if you do have good control, they are going to be, and maybe it is inevitable, maybe it's not, that you're going to have bumps, you're going to have slight increases in cases. And if you don't respond to those rapidly, then you will start to have outbreaks that result. So the learning part comes perhaps not in the fact that they were loosening their restrictions the last few months, because clearly it had an excellent response. The learning comes, what do you do when you start to see a bump in the number of cases in your population? How do you respond quickly? How do you get tested people quickly? And I think that's an important lesson to be learned from Hong Kong in that case.
Absolutely. While we're at it here, I mean, masking is mandatory in most places in Ontario, otherwise recommended. But do you mind if we just revisit mask protocol again? Because we still see people out there who don't wear masks. We see some who do, but it's below their nose. Some just wear it on their chins for some reason. So do you mind reviewing for our audience and best practices for how and when to wear a mask?
Sure. So generally speaking, the recommendations are that masks should be worn in all indoor settings, particularly in cases where you're not able to keep distance between each other, or that you're not reasonably able to expect that you'll be able to keep a distance between each other. So commonly in stores, places of work, restaurants, those kind of things. Outside, masks are also recommended in those same scenarios where you're not able to keep a distance. But if you're out and you're not anywhere near another individual, like in a park or another setting, you don't necessarily need to wear a mask. As for the proper wearing of a mask, the recommendation is that you touch your face minimally once the mask is on. You don the mask very carefully, you put it on your face, you cover your nose and cover your mouth at all times. If you don't cover your nose and it's just brought down, only covering your mouth, you're not doing as good of a job at reducing the likelihood of you picking up the virus or transmitting the virus, because it's important to keep in mind that you can pick up the virus through inhaling it either through your nose or your mouth, and you can transmit the virus by sneezing, not just by coughing, but also sneezing. So keep your mouth and your nose covered at all times. If you need to remove the mask, wash your hands carefully, remove the mask carefully, place it in a surface that's clean and dry. And then when you need to put it back on, for whatever reason, let's say you were eating or drinking or going to the washroom, put it back on again, washing your hands and carefully putting it on both your nose and your face and your mouth.
I'm curious, I'm going to throw a curveball at you here, Alon. When you're out in public, given your position, and you see someone not wearing a mask properly, I mean, I know I'm motivated to go up to them and say, come on, put it on or put it over your nose. What do you do in those situations?
That's a good question. Personally, it's not in my personality to confront people, but I get what you're saying. It is an important role. I think our culture and our society should be used to this idea that if somebody corrects you in your mask use or your hand hygiene use, we should accept that as constructive criticism. And I think we should try to move to that direction. We should try to do our best to think of it not as criticizing each other, but helping each other out. To say, look, it's good, wear your mask properly, cover your nose. I'm not saying this because I'm trying to be mean. I'm trying to say this because I want to protect you. That should be the way that our culture goes towards. I hope it does go that way. And you're right. Maybe I need to be a part of that. I need to be constructive and help other people out as well.
Well, I only raise it because this is going to go on for quite a while, for a number of months, and we have to remain vigilant. And another area of potential confusion out there as we reopen is, what happens to this whole notion of observing our social bubble?
Yeah. So even though as we move from phase 1, 2, and 3, the recommendation is to, you could expand your social bubble between 10 and then 50 people or more, we don't necessarily have to do that. So I think for the foreseeable future, we should all be in the mindset that if you can do something with distance between each other, if you can avoid some kind of interaction, then you should. Even if the rules say you can, it doesn't mean you have to. So if you're trying to maintain a bubble of 10, you don't necessarily have to see all 10 of those people in 1 week. You could try to minimize that exposure. And it's unfortunate, but that's the kind of mindset we're going to have to keep going with for the foreseeable future, particularly going into the fall and the winter when there is an expectation that cases are going to rise again.
And as far as house parties in the backyard, out in the backyard or inside the house, what's your guidance?
As best as possible, things should be done outside. We should take advantage of the fact that the temperature is warm now. We won't be able to do this in October, November, December. So we should take advantage of that now. And again, still within the restriction of your bubble, go outside in your backyard, maintain distance, remember to wash hands. If there is any need to go into the home, wear a mask. Don't come to any party if you're sick at all. Make sure you report your symptoms to healthcare and go get tested. The thing is that if we say, if the absolute most restrictive recommendation would say, don't do any of this stuff, stay at home, but it's just not practical anymore, especially because it's warm, especially because cases have fallen. Because if don't have, if public health measures and public health communication doesn't include these kind of risk reduction strategies, people are going to do it. We saw an example recently in Brampton of people having a party, more than 200 people. In New York State, the same thing, many places across the world. And people just do this behavior underground. So if we have very clear and safe guidelines, I think it's perfectly safe to do these things, just have to be very careful about it.
In your travels in the last several weeks, or as we continue to reopen, is there a sense at all that there's a perception on the public's part that, oh, as we reopen, I can relax my vigilance in terms of being, observing safe practices?
Sure, you think that would be and it's probably has happened to a significant number of people, but that people have been relaxing, they've been less vigilant. But the numbers show that people have been doing a very good job. Yesterday, Toronto had 1 case of COVID, which is remarkable considering it's a city of 3 million or so people, which shows that on one hand, yes, people are getting more relaxed, more, they're not paying attention as much, but clearly the vast majority of Torontonians are doing something right. They're wearing their masks right. They're getting tested. They're washing their hands. So it's an amazing thing to watch happen in real time. Because what I do in infection control, I see it happen in healthcare workers in the hospital, but this is essentially observing the same kind of thing on a huge level in the city, on the level of an entire city. So it's been very reassuring to see that people have been, in fact, following recommendations throughout the summer months. And that's reflected in the total numbers.
That's very encouraging. Okay,
Yeah.
let's talk about another huge issue these days, the return to school. I've read some health experts who say, let's hold off reopening for the first portion of the coming school year. Others say the province's new case transmission should be under 100 per day before we start up classes, and we just went under that for the first time today. So what's your take? Are the conditions right for students to return, or is it wiser to hold off?
Ultimately, we'll need to make that assessment in September, but what we could do now is make preparations in terms of what are the guidelines for preparing and opening safely. So you mentioned some of those numbers, which sound fairly reasonable. Who knows what the best guess is what that number should be? Is it 100 cases? Is it 10 cases? Is it 50 cases? Some reasonable number that a few experts or several experts in the field and with relevant stakeholders should be agreeing upon. And it's not to say that it's impossible to open safely. It certainly is possible. It just needs to be done under these careful measures. So right now, the goal would be to create those guidelines. As you know, there was the Sick Kids document that was released last month. There's various stakeholders involved in the discussions. The more, the better in discussing what the safest way to open up is. And to learn, as mentioned earlier, to learn from other countries. We saw a bad example in Israel, unfortunately, where cases were very low, but then they started to rise again as a result of school openings. We saw cases in Quebec where they were able to open up schools again in May. They had a few setbacks, but were relatively successful when it came down to June. Some openings in Netherlands as well. So there are situations where if the community prevalence is sufficiently low, it can be safely done with a few guidelines on how to do so.
So, I mean, you're an infection and control person. What would be your guidance in terms of the logistics of the classroom? Say, like, should the classroom size be reduced, or should attendance be staggered, or would you have a hybrid of in-class teaching and remote learning?
Yeah, it's a great question. Ultimately, we don't know the right answer. Nobody really knows exactly how to do it properly or when it's safe to open up. It's just a matter of trying to incorporate as many safe practices as you can. Those ideas that you mentioned are certainly reasonable to stagger classes, to minimize the class sizes. For example, having fewer than 15 students, to allow for a classroom that allows for distance between the students, greater than 2 meters, asking the students to wear masks, which is a fairly reasonable question. I think we've seen a lot of children, even under 10, being able to wear masks. They'll surprise you in their ability to be able to adhere to these recommendations. Having hand hygiene readily available, the alcohol rub available for students as well. Having a system in place so that students can report symptoms, not attend school if they're having any symptoms. Same with the teachers or any employees at the school. So those are kind of the big principles to go into it. It's going to be very challenging. It's going to go very slowly, I think. And people have to have expectations that it's not going to be a one-off, open everything, let the floodgates open. It's going to be slow opening, with sometimes steps going forward, sometimes steps going backwards.
And schools are such a big ecosystem, right? Because students and staff have contacts that go way beyond the classroom. Do we know definitively how much or how little students under the age of 19 transmit the virus? Because I know that's been contentious over the last several months.
Yeah, there's been lots of evidence going back and forth on the capacity of children to transmit. The overall assessment from most people is that their ability to transmit isn't as good as adults. One recent study looked at a group of 10 to 19-year-olds showing that they do have the capacity to transmit as well as adults, which probably reflects a kind of spectrum of transmission where the younger people are less likely and the older students between the ages of 10 and 20 are probably have a better capacity to transmit the virus. So this knowledge is evolving slowly over time, or as more places around the world are able to open up. Their schools are starting to see more data come out about the capacity for children to transmit. It's just important for everyone to recognize that it's certainly possible for the youngest child to transmit the viruses. There's no doubt about that. It's also rare but possible for young children to be sick and some even to die as a result of the virus. It's just simply a question of what's most likely or what's, how often does that occur?
What's between that? Like we have four to 5 weeks left before typically school would start in early September. What questions should parents be asking during this period?
Yeah, that's an excellent question. I think parents should be aware of what the policies are in the school, of what is the expectations of the child. So what should the child do when they arrive at school? What should they be doing at home to prevent transmission? What are the policies of the school itself to prevent transmission? What have they put in place, including hand hygiene, including social distancing, including masks? And then the third question they should ask is, what are the contingency plans? What if such and such happens? For example, what if one student becomes ill? What if one teacher becomes ill? Does the school have plans in place to figure out what to do when things go wrong? I think those are three of the big questions to ask. Of course, there's many permutations and various details to go into that. Those are the three kind of broad headings.
In the end, what strikes me about this whole issue is that no matter the safety measures that we put in place, it still seems as if parents are in this position of making a decision that feels like a calculated risk. Like this involves their child's health. So what would be your advice? Because it doesn't sound like this is a zero risk situation.
Absolutely. It's very challenging. Parents have to balance various priorities when they're discussing and thinking about sending their children back to school, because the parents have jobs. They have to keep in mind that. They have to keep in mind the best way they can attend to childcare. So if you have something in place and then the child goes to school and they become ill, or something happens at school, it gets shut down, the child has to go back home. Do they have childcare in place to look after them? Does the parent have elderly parents themselves who need to be, more careful about transmission from their grandchildren? There's tons of priorities here to think about it. It's a very challenging question. And of course, the well-being of the child is paramount. The child in terms of first their health and secondly, their education. So it's not an easy question to ask. And many societies across the world have already kind of tried to deal with this. And we can learn from how they approach the opening of schools before we do so here in Canada.
Absolutely. Well, I think your advice earlier of taking this step by step is warranted for sure. Okay, let's get to our audience questions on Slido. It's time to bring everyone else in here. First question. Excuse me, I'm just configuring Can air conditioners circulate the virus?
It's an interesting question. As far as we know, it's not a common mode of transmission. So if what the question is inferring is airborne transmission, we've discussed in the past that that's unlikely to be a large contribution of the pandemic. Probably a very small amount of virus is able to transmit through aerosols. If you're pushing air through a room where there are sick individuals, that probably puts people at risk, but not in the sense that it can easily pass through the vents, for example. So if you're in one room and there's a person in another room, a different room of the building, for example, who has the virus, there hasn't been evidence to suggest that person can transmit to you. If you're in the same room as another individual with the virus and the flow of the air is turbulent, that can certainly put you at risk for transmission of the virus, depending on how close you are to that person. But in terms of central air conditioning, that in and of itself is not so far known to be a risk for transmission of the virus.
Next question. Dr. Vaisman, in phase 3, the volume of people in public places will increase. Masking in indoor public places is becoming mandatory across many major cities. How do we prevent masking fatigue, which could lead to an increase in cases? Also, what are your thoughts on masking in the washroom?
That's a great question. How do we prevent masking fatigue? It's challenge. The big challenge here is that the virus is invisible and you can't see that what you're doing is effective, that it's actually very, very helpful. It'll seem like you're doing nothing at all, but in fact, you're doing a big service to society by wearing a mask. So to prevent fatigue, I think we just need to normalize the behavior. I think we just need to make, there's lots of other things that we consider to be good manners now in society, and nobody's really fatigued, wiping your mouth when it's dirty or, wearing a handkerchief at the restaurant. Like, these things are no longer considered out of the blue, or out of normal, I should say. So we need to just normalize this behavior and just say that this is now what you should be doing for the foreseeable future. Things that could make it a little bit easier is providing masks, making masks more available to people, and making comfortable masks more available to people as well. If people are wearing some of the higher level 3 masks that we refer to in the hospitals, it's a little bit harder to breathe through. That's really not necessary for the public to wear. Those are for resistance against high splashes, which doesn't occur in the public. So if people wear a cloth mask, which is a little bit thinner but still provides protection, I think that'll prevent people from being fatigued of it, as it's a little more comfortable to wear. Also, masking in the washroom, we've here at UHN, for our employees, we've recommended that you don't necessarily need to wear a mask in the washroom. However, if you're walking by a narrow hallway to the washroom, you should do your best to wear a mask. It's a challenging thing to actually put in place, because when you're in the washroom, it's not really a good idea to accidentally contaminate it. So it's not exactly necessary to wear a mask in the washroom, particularly if you're there on your own. There isn't really much of a risk of you contracting the virus. But outside of that, if there's any kind of sense you might be in close contact with people, you should do your best to try to wear a mask.
Thank you. All right, next question. What are your thoughts on the potentially exaggerated risk of transmission via inanimate objects, as per the Lancet article by E. Goldman, July 3rd? Are we, people and businesses, spending too much time worrying about sanitizing surfaces when we should be focused on universal masking and social distancing?
It's not really a zero-sum game when it comes to social distancing, masking, and cleaning. It's not like you need to spend $1 and you can only spend it in so many ways. I think these are all mutually compatible things that you should be doing in an office space or in a public space. Washing surfaces, it makes a lot of sense, not just for COVID, but also come flu season. It'll be important to get rid of flu and other respiratory viruses, plus other bacteria that are on surfaces as well. Some areas it's going to be far more important to sanitize surfaces, like, for example, in washrooms or high-touch surfaces like handles. Some areas it's not going to really be important, like areas in a room that people aren't really touching that frequently. So it's not so much that we need to focus on one or the other. We should be doing all these things. And we're talking about sanitizing surfaces, focus on the areas that are most likely to have an impact. Sometimes you see like trucks spraying sanitizer across an entire street. Like, that's a very low yield maneuver. It's not likely to be effective. It's not likely people are going to be touching those surfaces. But when you're talking about enclosed surfaces where a lot of hands are touching every single day, that's where really sanitizing surfaces make sense. So although in actuality we aren't seeing as many transmission events from the fomites as described in this question, it's still an important and relatively straightforward maneuver, and sometimes even cheap, to clean these areas and reduce transmission.
Very good. Next question. I never show up to a social function without food and drinks for myself and others. Am I encouraging bad behavior if I bring a bag of chips for all? Can we just wash our hands and share?
Yeah. Our recommendation in hospital settings, for example, or workplaces, isn't to eat food that could be that isn't contained or that isn't individually wrapped. So chips would be a bad example of what you could bring, because if you put it in a bowl, everyone's hands is touching the bowl, and now you're bringing it directly to your face. But if there's something that's individually packaged, like a small bag of chips for each person, then that's fine, because all you're doing is eating from your own supply, for example. Drinks are generally fine, because as long as they're individual for for one person, for example, nobody's actually needs to touch your drink for you to be for it to be at a risk for contamination. For example, like wine, you could pour wine and not contaminate the wine glass or not contaminate the wine itself. You just need to be very careful, wash your hands before you're handling it, or pour the wine yourself and wash your hands, even with alcohol rub, before you touch it. So as best as possible, try to avoid things that are shared, but there's lots of other options out there of things that you can bring, but are not actually shared in a communal way where everyone's hands are sort of going into it.
That's a good point. I never thought of that, actually. Vegetable dishes and other type of, like, fresh vegetable dips, that kind of thing too. Same idea.
Yeah.
All right. If stage 3, this is from Phyllis Burke, if stage 3 starts an uptick in cases, are hospitals more ready now to respond with PPE, ventilators, etc.?
I think the general answer is yes. I can speak to UHN's experience. I and the other infection control physician, Dr. Hoda, as well as many other departments, the emergency department, ICU, general medicine, transplant, where everyone is now actively working on preparing for a potential second wave of the virus. So here at UHN, all these departments we never really take the time off now. We're still working on this because we know that it could happen again. So here at UHN, everyone's doing a lot of work to prepare for that, including PPE as well. We have a pre-PPE working group with various stakeholders from the hospital, making sure that our supply is good, looking out for new supply, keeping track of what we're using so far and what we're using today. So here at UHN, there is an excellent level of preparation, and I would imagine that's going on in many hospitals in Ontario. The question is, what's the plan from the federal government and the provincial government, and how those are going to tie together? And that's going to be hopefully developed in the next few weeks. We'll hopefully see something about what the formal plan is from them about preparing for a next wave.
And I know actually through donor dollars too, there's been research done at UHN which has come up with innovations such as 3D printer PPE and being able to somehow refurbish N95 masks. So innovation is still going on, or is going on, to help increase capacity within UHN. And that's
Absolutely.
also thanks to donor dollars.
Absolutely.
Next question. My daughter is returning from Vancouver to Toronto by plane. She has been very careful in Vancouver. Does she need to quarantine for 14 days when she returns to Toronto? My wife and I are in our 60s. That's a good question.
Yeah, the number of cases in BC has remained low recently, and the number of cases in Ontario is continuing to drop, particularly in Toronto. Regarding the question about quarantining for 14 days, it'd be important just to check the province of Ontario, the guidelines about quarantining. My understanding is that the most recent recommendation is to still continue doing that after travel from outside Ontario, but I would recommend to the person asking the question to check the province of Ontario, the Ministry of Health recommendation around travel from outside. I suspect that is still the recommendation. But the risk is low regardless, now that the cases across Canada have dropped dramatically over the last 4 to 8 weeks. The risk is probably low now that you would pick up COVID in Vancouver or Toronto, but of course not zero, which is why we're still doing all these measures to try to prevent transmission.
Exactly, yeah. Next question. My husband and I are seniors with underlying issues. My question, with the constantly emerging new knowledge, is disinfecting groceries still considered a priority? Also, with people wearing masks, how safe are, example, TTC, the ROM, and AGO for vulnerable people? Thanks for doing this.
Yeah, thanks for the question. So regarding groceries, they were really never that high a risk. We kind of touched on this earlier. The fomite transmission initially was thought to be an important mode of transmission. It still probably is a significant contributor, but not as important as we previously thought. The likelihood of the virus surviving on inanimate surfaces is likely not very long. Some cases it may be up to days, but likely most of the time it's within hours, depending on the surface, the humidity, and the temperature. But the way you can mitigate that risk, regardless of how long the virus can survive, is to simply wash your hands before you eat. And if it's a type of food that can be washed, you wash that food. Or if it's a type of food that needs to be cooked, you cook it. So washing your hands before you eat can really reduce your risk dramatically. People kind of underestimate how important that is even before COVID. You can cut down a lot of transmission of disease, bacterial and viral, by just simply washing your hands before you eat, and then keeping your hands away from your face while handling the groceries. Regarding the TTC, ROM, AGO, as every day goes on, the risk is declining. So as I mentioned, we only have one case of Toronto of COVID yesterday, which means that it's very unlikely there's a high level of transmission going on, which means that if these places, if Rami Geo starts to open up in any kind of bigger way, the risk is likely very low. And when they do open, or when they open, it'll be likely in a much safer way than it was in the past, where there's not going to be that crowding anymore. There's likely going to be far more measures in place, understanding that a lot of vulnerable people are going to be there who have underlying medical conditions. So keeping distance, making hand hygiene available, mandating mask use in these areas, all of those are going to dramatically reduce the risk in these places. And of course, if you're entering these places and you see that these things aren't going on, I think people should take the initiative and just not enter or leave. If you see that there's crowding, if people aren't wearing masks, if the room is not well ventilated, and people have to make the decision just not to enter that room, not enter that building.
All right, next question. What is the general attitude of healthcare workers right now with respect to COVID-19? Encouraged, frustrated, nervous, hopeful? Probably all of those things.
Exactly. Yeah, that's a really good question. I think a lot of people at UHN were understandably stressed by the whole experience because we had many patients here, many healthcare workers looked after them directly. There's always the risk hanging over us about picking up COVID. But I think now that the cases have come down, now that we've seen how well we've handled it and how great the response has been, I think people are more reassured about a next wave of COVID. We learned a lot about management of the disease, about also the structural, what to do at UHN in terms of policies and guidelines. And so I think the healthcare workers, their sentiment is probably more reassured than it was in the past. I'm sure there's also that nervous feeling of what's going to happen in the fall. Nobody knows what's going to happen. So I am getting the sense that people are a little bit anxious about that, but more so than in February, people are hopeful, I'd say. I think there's a lot more to be hopeful about, including news about a vaccine, than compared 6 months ago.
I have to say, having spent a few weeks behind the scenes in the ICU and in the emergency department with frontline workers, the courage they demonstrate every day is it's phenomenal. And it's, they work 5, 6, 7 days a week, sometimes long hours, and they've been amazing.
Yes.
Next question. An American friend said that she was going to ignore what the governors said and look to the hospitals. When hospitals allow unrestricted visitors, she would know it was safe to go out because that decision would be based on science, not political expediency. Thoughts on using this as a benchmark?
I think if you're going to use the hospital as a benchmark rather than federal or state level recommendations, you should be looking at all of their policies and see whether they're consistent and whether they're scientific. If you see them citing data, if you see them adapting to science, adapting to the prevalence of disease, then that could be a more reliable way of figuring out what to do. But that's not necessarily the case with all hospitals. Some hospitals have different motivations, different priorities, so they may not be as responsive to the science as you'd hope they be. So if you're going to use a hospital or a specific hospital as your benchmark, try to look across the board at all their policies. What are they doing about not only visitors, but what are they doing about elective surgeries? What are they doing about elective clinic appointments? What are they doing about PPE requirements? Are they asking their visitors to be screened before they come in? Are they asking patients to wear masks? If all those things are consistent and show a sign that they care and they're looking at the data, then I think that's a fair way of making an assessment. But it takes a bit of work to go through that and examine that.
Yeah. Next question. Is it safe to travel in a car if one person sits in the back with a mask and the driver has a mask?
Yeah, that's an interesting question. We don't know whether there's been transmission in such a specific setting. We have had anecdotes of cases where there has been, early in the pandemic, of cases in Southeast Asia of transmission occurring among a taxi driver and a person in the back. But that is in a higher prevalence setting. It's hard to know whether that risk still carries now in July in Toronto, where we have a very few cases. In general, that's the recommendation for taxi drivers or Uber drivers is for both to wear a mask, for the window to be rolled down, and then for them to be sitting at a distance as far as possible from each other as possible. So that doesn't reduce the risk to zero, but it does dramatically reduce the risk, especially if both are not having any symptoms. So I don't know if the word safe can be used. The word safe is always challenging to use when we're talking about COVID measures. All I can say is that the risk is probably low, but not zero. And if you can avoid those scenarios, then you should.
Very good. Next question, Dr. Vaisman. We are seeing more reports in the media lately, such as from the Mount Sinai Health System in New York City, about people who have had COVID and are experiencing long-term lasting symptoms, even in younger and presumably healthier individuals. What has been your experience with this issue?
I personally haven't had any experience with this issue because I haven't looked after COVID after in this period where they're looking at patients who've had the disease and now several months out are experiencing long-term issues. All I can comment on is that same data, excuse me, that people have been having long-term issues. An interesting paper came out this week about the cardiac manifestations, the heart manifestations after patients who've had COVID. A significant number of them have had abnormalities after they've had COVID. And so there is mounting data that some symptoms, including fatigue and cardiac manifestations, can be chronic, and some muscular symptoms as well. What proportion of that will persist? Because perhaps it could be a manifestation the first few months, but then it will go away. We don't know the answer to that yet because the pandemic's only been around for half a year. So all I can say is that the data is starting to mount that there are long-term consequences, unfortunately, with having COVID, which would make it different from the other common seasonal coronaviruses where no such long-lasting effects are seen.
Yeah. Next question from Nat. For people at risk, how strict do we still have to be with our household? Can teenagers get a job, go to school, go to the mall, or should we all still cocoon as much as possible? Are there procedures they could take to minimize the risk to the person who has compromised health?
Yeah, I think the first principle is to follow the recommendations of the province and your region, depending on the phase that you're in terms of who you can be with and what kind of things you can attend to, restaurants, bars, malls, all those things. So first of all, there's those recommendations, and that will restrict you to some degree. The second level is to consider whether what you're doing is essential. So if you can find a way to avoid it in some way, if you can, instead of gathering 6 people in one room, you can do it remotely, for a meeting, say for work, then you should. If you can distance in a room, if you're going out, let's say you're at a patio and you're looking for where to sit, there's an option to distance, then you should distance. So the second thing is to always minimize wherever possible, to think about that. That's not to say you should fully restrict whatever you do, because you can truly do things safely now with those principles that we've talked about earlier. But with somebody, the third thing is to consider the risk then. If you're an individual who's particularly a higher risk, then all your risk thresholds should be higher. You shouldn't be doing things that potentially put you at risk versus a person who's otherwise healthy, who probably can withstand a little bit more than you can. I think it's a challenge, of course. Everyone has a different sense of what risk is to them. But I think those individuals should be a little bit more careful of what they do in terms of going out in public. And what I mean by that is, even if the phases change, if you're going up to another phase in terms of expansion, you should be a little bit more hesitant to kind of participate in those activities.
Very good. Next question from Madeline. Are antibody tests available? If so, where can we get one?
They're currently being used in research studies, but aren't yet widely available. They're approved in the hospital setting. You can order one. There's plenty of tests you can order from US or outside of Canada that are not approved by the Canadian federal bodies. So you have to kind of take the results carefully and think about it carefully. So basically, you order a kit and you can take a prick of your blood, and then it will tell you whether you are antibody positive. But those aren't approved in Canada, many of them. So you have to just be careful when you interpret the results. Soon enough, there will be approved antibody tests available to patients. But right now, it's not yet approved. For example, at UHN, we don't yet have a reliable antibody test that we use for clinical purposes, only for research purposes.
Right. Which in part is testing their veracity.
Yes, exactly. It's testing, making sure we understand the interpretation of the result, making sure that it's accurate, sensitive, and specific.
Next question. Susan says, as a senior, I am very leery about entering phase 3. As much as I would like to go out for dinner, the distance between the tables might be 6 feet, but the distance between people eating together would not be. Does that mean eating out at a table should only be with people in your bubble?
Yeah, that's a very good point, is that in settings where you're not able to distance, then essentially that is the case, that people who are not able to distance are essentially in the same bubble. So that means you can't start doing activities with somebody with less than 6 feet who are not within your bubble. So that's exactly right. It's an important observation to make, that is the case, and we should try to maintain those bubbles as best we can, despite us moving along the phases. As I said earlier, just because you can expand your bubble doesn't mean you have to. You just think about it very carefully for you and your family.
And another bubble related question I would say here next is, can you stay overnight with a family at their cottage if you wear a mask inside?
Again, with these questions, I would say, first of all, follow the recommendations of the local health region and the province in terms of what phase you're in. And secondly, if you're not in the same bubble, then you do potentially run the risk of transmitting between each other. So that could potentially be a higher risk activity. When you're relaxing on vacation, you're less likely to adhere to the common sense kind of practices, including wearing a mask or washing your hands, keeping distance. So even though on paper it might sound like, great, you're at a cottage, you're wearing a mask, no problem, but probably in reality, things are not going to be done properly. And so you're effectively putting them in your bubble, you're effectively exposing each other in that scenario.
Next question. I am invited to a wedding reception with less than 50 people attending at stage 3. The venue seems to be following the rules, but I'm a bit nervous. Any advice?
Yeah, that's a tricky one, because things like wedding, of course, they hopefully only come around once in a lifetime for those individuals. So you don't want to have to miss it, especially if there are measures being taken to protect you and all the other guests. So I think it's about, again, but it goes back to your risk assessment. And again, assuming that that's in line with the recommendations of the region and the province, then you have to just kind of make your risk assessment. You go to that place and you're not seeing the safe things being done. You're not seeing the distance being kept, the masks being worn, or hand hygiene being done. Then yeah, I think that you have to make the call for yourself that it's not safe for you to be there. So you might see it on paper, you might see it in real life, and then have to make a decision about whether you feel it's okay for you. But you probably have to actually go and see what they're going to be like, or maybe speak to them ahead of time to figure out whether they're going to be adhering to the practices that'll keep people safe.
Yeah, that's a tough one. Next question. What is the overall lifespan of this virus? i.e., how many years did the Spanish flu pandemic last? And would that be a fair comparison to COVID-19?
Yeah, the thing about flu is that strains of the flu, they mutate from year to year. So the strain that you might have seen in the Spanish flu initially in 1918, it may have lasted for several flu seasons, gone away, and then returned. So a good example, more recent, is H1N1. That was a pandemic in 2009. That strain was unseen for a very long time. But then after 2009, it's essentially been part of the flu milieu since. So every single flu season since then has had some degree of H1N1. So flu is a little bit hard to compare, whereas with COVID, it's a completely novel virus, and coronaviruses don't have the same kind of mutation that flu undergoes every single year, which kind of explains why we have flu seasons. With COVID, we don't know, first of all, about the degree of seasonality. We suspect that it's very low, that it's not seasonal, that it can persist even in winter and summer. And secondly, we don't know about the ability to mutate in the long term. We don't think that's the case, but we just don't know that. We just don't know that, and that speaks also to the ability of humans to be immune in the long term. So, say it can mutate. Does that mean that a potential vaccine, or potentially somebody who's infected in the past, is immune for life? We don't know. So, the lifespan of the virus, it's too early to tell, unfortunately. If immunity is long-lasting and the vaccine is effective, then the lifespan of the virus won't be long, but we just don't know the answer to those two questions.
Exactly. I just want to ask Dr. Vaisman, we have so many questions still. Can you stick around for several more minutes with us?
Yeah,
if we
no
can
problem.
extend our time, just
Absolutely.
to let everyone, the production crew know as well, we'd like to extend
No
our
problem.
time.
No problem.
Great. Next question. Is it safe to have sex with someone you are not living with who has a roommate?
Well, essentially, if that
As long as
person,
they're masked? No, I'm kidding.
yeah, essentially that person you're having sex with is in your bubble. Their roommate is essentially in your bubble now as well, because living in the same space as somebody means that you're likely sharing the common services are being shared, utensils are being shared. They're probably not keeping distance, probably not wearing a mask all the time. So effectively, you three are now all in the same bubble. That's not to say that's not allowed. As we know, there is a limit to how big your bubble is, but just be aware that they're now in your bubble, whatever that means to you. If you've already exceeded your 10 people, or if that person, the roommate, is somebody who already has a very large bubble, then you should try to avoid that. But that's essentially what it means. You should just consider their roommate to be likely part of your bubble now.
Good advice. From Kala, another question: Can we report retailers for not following the rules? I was shopping in Healthy Planet Canada yesterday, where every day is Senior Day, and the attendee was not wearing her mask properly, slung it below her nose. When I told her I was nervous, she replied she was too hot.
Yeah, that's a good question. It goes back to your earlier question about what to do if you see somebody not wearing a mask properly. In this case, it's a retailer, so you have some recourse in speaking to the management there. And again, it has to be framed in a way to try to show that you're helping rather than being accusatory or trying to
Exactly.
be
Yeah.
punitive in any way. But yeah, in the case of a retailer, you can go to that workplace and talk to the leadership there about masks. I suppose if a business itself is not responsive or not interested in it, um, public health would be the people who you can communicate with, your local public health authority. So in a similar way that you would report a restaurant where you suspect there's health violations, like with the food, for example, you could speak to public health about a specific business. They may be very busy and they may refer you to another resource to speak to, but that would be one place you could start.
And certainly, some companies, a number of companies, have ombuds people they have a department, so that it could also be referred to them.
Excellent point. Yeah.
Next question: I have a 2-month-old, I'm guessing, baby. What precautions should I be taking?
I think with babies, we regardless of COVID or not, people do take extra precautions to try to minimize exposure of the baby to the outside world, especially to sick individuals. So there's the obvious things like not taking your baby into large crowds or hospitals or office places where there's potentially a lot of people. But then there's the other things that we should try to one should try to adhere to as best as possible that are part of the already long-standing recommendations related to COVID. So simply about taking those ones more seriously. So thinking about restricting the bubble as much as possible to that baby. So if the parents of the baby are interacting with a lot of people, you should consider that person is essentially the people you're interacting with are indirectly interacting with your baby through you. In other words, if somebody you met has COVID, then you're a potential transmission source to your baby. So for the caregivers of that baby, the best recommendation I could give is to try to minimize the exposures that they have to the outside world, to create as small as bubble around that baby as possible to try to reduce the likelihood that baby can pick up the virus. And then as I mentioned, sorry.
I was just going to say, I guess, because the challenge there would be a 2-month-old wearing a mask is probably not tenable.
Exactly. That's it. Yeah, it's likely not safe. It's not tenable. It's not sustainable. So the best thing you could do is try to reduce transmission from the caregivers and try to prevent the caregivers from interacting with people who potentially could have a virus. Try to tighten that bubble as much as you can.
Great. Next question: why do we use the nasal swab and not a less intrusive test?
That's an excellent question. So we do perform oropharyngeal swabs, which it's uncomfortable. So sticking the same swab or a similar swab into the oropharynx in the back of the throat, the sensitivity of that test isn't as good as the nasopharyngeal swab. There have been other attempts at using saliva. So the patient puts some saliva in a container and that's tested. That's another method of testing, and in hospital settings, we have other more invasive ways of testing, but that doesn't really answer this question. The point is that nasopharyngeal swabs currently are the most sensitive tests and specific tests that we have. But people are looking into other methods of testing, but they're not yet ready for live rollout and for the public.
Exactly.
Unfortunately, that's the best that we have currently. That is traditionally the way we've been doing it for flu and other respiratory viruses as well.
Yeah. Another question. If you test negative, is that 100% accurate up to that point, or could the virus be you but not manifesting, and then you develop it over the next few days?
Great question. Yeah. Well, if you test a negative and you actually have the virus, there's two possibilities. One is that the virus was simply not picked up by the swab. The second is that you actually have the virus. It's not in your nasopharynx, but it's incubating. It's not replicating in your nasopharynx, but it's incubating in you so that it's not picked up by that virus, by the swab. So yes, we suspect that the swab is about 75 or 80% sensitive, which means there's a 20 to 25% chance approximately that you actually have the virus, but the test is not picking it up. Hence why if you have sufficiently concerning symptoms, you may want to go back and get tested again. So that's what we do in the hospital. That's what we do with patients. If they have a lot of symptoms and we don't have an alternative explanation, we test them more than one time. If you have very mild symptoms or you have no symptoms, a negative swab is much more helpful. It's much less likely that you have the disease in those settings. The moral of the story is that if you continue to have symptoms and your test was negative, go back and get tested a second time.
Very good. Next, until we get a safe and effective vaccine, are there ways to increase innate immunity to COVID-19? If so, is there an app, hint, to help with that?
There isn't really much you can do to increase your innate immunity. I'm not sure what they're getting at with a specific app.
I wasn't clear either.
If you're talking about vitamin D or zinc or other supplements, there's no evidence to suggest that those protect you against COVID or any other respiratory virus. The most important elements of keeping a good immune system to protect you against COVID and other viruses and bacteria is really the common sense things: is getting enough sleep, having a good diet, and exercising. Those individuals are the most likely to have a good outcome if they are infected by COVID, or they're most likely to have a more mild disease. Whereas if you take the opposite side, there's some people who, of course, don't have control over those variables. They have illnesses that they just happen to have that unfortunately puts them at high risk. But what you do have control over is those three things. As for supplements, there isn't really anything you can do. So basically, before we have a vaccine, get enough sleep, eat well, and exercise. I know it's not a sexy answer, but that's the only answer there is out there.
Absolutely. Well, we have to rely on the science. I'm being told this is our last question, Dr. Vaisman. What has been learned about COVID-19 in the last 6 months? Does it change how we should behave?
Yeah, if we go back 6 months to January or February, one of the most important things we learned about is asymptomatic transmission of the virus, which I think a lot of the public fully understands now, is that people can transmit the virus even before they have symptoms. So how does that change our behavior? It means that you have to be vigilant all the time. That's why we're talking about mask wearing, even when you don't have symptoms. That's why you're talking about washing your hands, about keeping distance, even when you don't have symptoms. But one of the most challenging things about this virus is that transmission before you have symptoms. People don't know it, and they're giving the virus to their families, friends, coworkers. If we can get on top of that, if we can cut that transmission, that's going to be one of the best ways, and we see that in reality, to end this pandemic, or at least to minimize transmission to a significant degree.
We have come to the end of our time again today. To all of you out there, thank you for joining us. We'll be back in August to answer your questions again. And to Dr. Alon Vaisman, so great to have you back again from UHN Infection Control Physician. And thank you for your insights and sharing your time and your expertise. We really appreciate it.
No problem. Thank you again for having me. I appreciate it.
So this live stream, as always, is available on the Foundation YouTube page. And for anyone interested in donating supplies or support items for our frontline workers, you can email us at covidsupport@uhn.ca. That's COVID support, all one word, @uhn.ca. And someone at the Foundation will be glad to help you out. And finally, donor support, as always, is critical to the work we do at UHN, both on the front lines, as well as the hundreds of researchers now striving behind the scenes to work to find new treatments for this deadly virus. If you're able to give, we ask you to consider making a donation. Visit www.tgwhf.ca/help now. Thanks for tuning in. keep practicing physical distancing, washing your hands often, mask up, and stay safe, everyone.